Hi, Dr. Pelto here. Just want to show you how this works for a diabetic patient using Athena. Here's the past medical history. This was all filled in by the staff. The history of medical uh, present illness. CDFE is comprehensive diabetic foot exam. The review of systems, which my assistants put in. There's a couple of physical exam templates that we use. One of them is routine foot care. The other one is a comprehensive diabetic foot exam. They have some overlap, and to find them, you just go up to these all pull in save findings on these that are preset phase save findings that you can get, and I can send to you. There's also different blank templates that you can use on different topics. And once you fill it out, you can either add them or delete them. I just like the regular CDFE one. Most of this pulls in some normal values for this patient. The patient had some class findings, absent pulses, and he did have neuropathy. And so we filled this in here. The pulses were absent. That's the main thing. With this patient, he did have some callousing. He had some nail issues. He did have a little bit of a ingrown nail with some purulent tissue that was more on the medial hallux region. So that's what I'm going to put in here. On the great toenail, everything else looked good. He did actually have some maceration to the fourth web space. He had that bilaterally, so I could just copy this and put it right here. Everything else looked good in the foot. He had some calluses in the IPJ and first met head bilaterally. No real signs of infection noted. Neurologically, he was diminished, so vibration, you can see here it was absent. His Sims-Weinstein, he was unable to detect, and he did have some lack of feeling. Going down to the musculoskeletal exam, he didn't really have anything. No Charcot. The toes all looked fine. His gait was normal. I did some callousing and some nail trimming for him today. It pulls in this prescription drug monitoring report. He had an ingrown toenail, a little bit of a paronychia. He has type 2 diabetes, and I just chose diabetic polyneuropathy. It was really easy to do. You just expand things and you choose which one that he had. And that's what this patient has. He didn't want diabetic shoes, so I didn't put that in. If he did, it was pretty easy to put in. And then, so basically the CDFE I put here, and I do dot code CDFE. It was complete. And then I was going to say here, patient has higher risk foot issues due to neuropathy. And poor pulses. He did come in for nail care, so I have some dot codes as you put dot and then nail care, and he's going to be coming in for that. He also did have a little bit of a paronychia. This was trimmed back and treated with nail care today, and no anesthesia was needed. So I didn't need to numb it up. I just trimmed it back, so I'm not going to really bill anything for that. I'm going to see him back in 9 weeks for this. And if you want to do another appointment, you could put it in pretty easily right there. Then the sign off, kind of looking everything you did, I can send a copy to his doctor. And then you open up the billing tab. It's really easy. So for him, I'm going to do a new patient visit with a diabetes. I'm missing a callus code, so I'm going to add that. And for the nail care. So if I hit save and I go back here, up on the top, I can add in callus. So if you pull in routine, it'll pull in fungus, callus, and all the other stuff. If you just do the callus, it'll pull in the callus. You hit sign orders and you go back to the billing sheet, and I can add in callus right here. So as you can see, this patient's billing tab is done. The note to the primary care is done, and then I can close this for this patient. So this is how you do it for a diabetic patient.